Hi speech pathologists, this video is to help you prepare for the OET Speech Pathology speaking test. I'm going to explain how to approach a speaking role play, make the most of your preparation time, demonstrate the assessment criteria in your speaking, practice the role play and learn from each role play you complete. Ready? Let's go. The Speech Pathology speaking test requires you to role-play two different situations with an interlocutor. You will always take the role of the speech pathologist in the conversation, while the interlocutor will take the role of your patient or a family member of the patient, for example, their husband or wife, adult son or daughter, or the parent of a young patient. The two role-play situations will be quite different to allow you to demonstrate a range of English expressions and functions which are typical for healthcare conversations, including reassuring, explaining, persuading and asking questions. The interlocutor, as the patient or family member, might also have an emotional response to their health condition, such as anxiety, frustration or sadness, which are all common emotions speech pathologists deal with every day, and allow you to demonstrate your empathy and ability to manage the patient to make the right choices and decisions for their health. Everything that you learn while preparing for OET speaking will be immediately useful to you when starting your new healthcare role in an English-speaking environment, and give you the confidence to tackle any situation, from giving bad news to explaining the steps of a healthcare treatment. By demonstrating flexible, accurate English and responding appropriately to the interlocutor, you will demonstrate to the assessor and regulators that you have the language required for an A grade. Before each role play, you have 3 minutes to prepare for the conversation using the role card. Remember that you can ask the interlocutor questions during the preparation time. If there is a word you don't know the meaning of or how to pronounce, you can ask this during the preparation time, and if the interlocutor knows the answer, they can tell you. Let's look at a speech pathology card in more detail. There are 3 sections to the card: the setting, the background information, and the list of tasks. Here are my recommendations about what you should do during your preparation time. Notice the setting of the role play. Here it is a private clinic. This tells me that the situation is not urgent and that I may or may not have met this patient before. Look through the background information to find out some details about your patient, for example, their age and any adjectives which describe how they're feeling. I can see that my patient is a 4-year-old boy, but that I am speaking to their parent without the child being present. I have the adjective upset to know how the parent is feeling. This information is useful to think about how I am going to start the role play. The fact that the parent is feeling upset tells me I want to sound kind by choosing language which will reassure them and help them to relax. Check the healthcare condition the role play will be about from the background information, as well as any useful details which might relate to how the parent will respond to questions and options I suggest during the conversation. I can see that the parent is here to find out why their son is insisting on talking like a baby, which they have noticed, as well as the son's teacher. They have recently had a baby girl. I need to demonstrate I am listening to their concerns and have some strategies to help them. Read the tasks to check what needs to be discussed in the conversation. The verbs starting each task are really important in helping me to understand what I will say and how I will say it. Find out means to ask questions about the reason for the parent's visit. Reassure means to help the parent feel better about their son's babyish speech, while also asking about any other changes noticed in the boy's behaviour. Give reasons means to tell the parents some explanation for why the boy's speech might have regressed. Explain means to tell the parent that this type of behaviour is common. Recommend means to tell the parent some strategies to encourage their son to speak normally, while also suggesting that the parent follows up with the boy's teacher. Lastly, run through this checklist. Is there anything unexpected to the parent in what I am going to tell them? In this case, the answer is no. The tone of the tasks is positive. Is there any medical language on the role card I need to avoid because they won't understand it? Again, no, all the language in this task is suitable for a lay person. Which tasks do I need to spend most time on? From checking the tasks again, I know I want to allow plenty of time for tasks 2 and 5. Task 3 could also need a bit of time to discuss the possible reasons for the speech regression sensitively. I should aim to move through tasks 1 and 4 fairly quickly. The OET speaking test is unique in that it simulates the real-life conversations you have with your patients as a speech pathologist. It's important to remember this once the role play starts because it will help you to communicate naturally and effectively with the interlocutor as your patient. Here are a few tips to speaking clearly and demonstrating the assessment criteria. Get the role play off to a good start. You are expected to start the conversation as you would in real life. Make use of the information you picked out in the preparation time to start the role play appropriately for this situation. I know this parent is upset, so I choose to start. Hi, my name's Rebecca. I understand you've come in today to talk about your son's speech. Can I just check your name and his name, please? This isn't the only option for starting the role play. I could be less direct and say, what can I do for you today? But my feeling is that this is a routine situation which I can provide some easy reassurance about, so moving towards this fairly quickly will help the parent feel better sooner. Take time to listen to the parent and respond to what they tell you. The role card gives you a lot of information about the conversation, but you cannot know exactly what the parent will say in reply to your suggestions and advice, so make sure you are fully listening to what they tell you. Don't use this time to think about what you are going to say next, or you could miss something important. Show the parent you have listened by responding with something appropriate. For example, the parent might tell you that they are struggling with the needs of both their children at the moment. The baby needs a lot of attention, but they are worried about the impact this is having on their son. Show you have listened by commenting on what they have just said. I'm not a mother, but I understand this feeling of divided attention is really natural when you welcome a new baby to the family. I have some strategies you can try with your son which should help. Be authentic in your role as a speech pathologist. Sometimes you will need to be firm and tell the patient that what they are asking is not good health advice, or at other times you will need to clearly explain a process the patient is unfamiliar with. Do what you need to and make sure you match the tone of your voice to what you are saying. In this task, you need to show lots of reassurance. To do this, make your voice sound warm, use kind vocabulary choices, and don't speak too fast. The good news is that babyish speech is often just a phase and will go away all by itself. It's good to keep an eye on, but it isn't something you need to worry about particularly. Remember that this situation is new to your patient. Many people are fortunate to have good health for most of their lives, and on the occasions they do need to seek medical support, they feel vulnerable and anxious because they do not know why they are feeling this way or how the problem might be resolved. Although you might have talked about speech regression in small children many times before, this is new to this parent. Try to put yourself in the parent's shoes and think about what you would want to know about the condition if this was the first time you were discussing it. There are a number of ways you can practice the role play with a family member, a friend, or a colleague. It's important that you only look at the speech pathologist card before you practice, so that you are only getting the same amount of information that you do in the test. If you print off the role cards, tear or fold the page in half so you only have your card, or if you are looking at the task online, change the size of the card so you can only see your part. Ask your patient to play their role fairly. If the task says they are worried, they should use language to show this. If it says they are frustrated, then similarly they should use language to show this. OET roleplays will never use extreme emotions like anger or tears, but it will help you prepare if you feel that slight pressure which comes from facing a patient who is feeling negative and trying to help them. Record the conversation on your phone so you can listen back to yourself afterwards. You can also use your phone as a timer to alert you when 5 minutes is complete. If you turn your phone face down in front of you, it will still be able to record, while you will not be tempted to keep checking how much time is left, which is something you cannot do in the test. At the end of the role play, ask the friend or colleague who took the role of the patient, how they felt during and after the conversation. Did they feel informed and supported during the conversation? Or was anything confusing, leaving them uncertain and with questions at the end? Consider this feedback and how you can improve on this for next time. Once you've practiced this role play, make sure you don't miss out on the extra ways you can use it to improve your English and prepare for OET. Here are 4 things you can do with any role play card to get the most value out of it. Assess your recording against the assessment criteria. The criteria are free to download from the OET website and contain both a description of the linguistic and communicative criteria you are assessed on, as well as the evidence of what the assessors are looking for to be able to score you at the different levels. Take each criterion in turn, read the evidence statement for each level, and critically decide which statement is the best match for your speaking in the recording. Practice the role play again with a different partner or by changing a small variable of the role play, for example by changing the patient's age or the emotion the parent is feeling about the situation. Think about the different language you might need to use for this role play if the patient was older and it was perhaps linked to parental divorce. Or notice the questions and responses the different partner uses when repeating the role play with somebody else. Each patient is different, so although you are using the same cards, you need to be prepared to be flexible and communicate with this individual rather than preparing a set of phrases you hope to use each time. Use the role card as a basic outline for a writing task. Imagine you are writing to the boy's teacher who noticed the speech regression. Use the details in the patient card and your recording to present the background to the situation and what has been discussed today. Recommend the teacher monitors the boy's behaviour and contacts you if there are further signs of speech regression. Search the internet for podcasts on speech regression or medical journal articles covering recent developments in the treatment of the condition to practice your skills for the reading and listening parts of the test. Candidates tell us that the preparation they do for the OET speaking test is immediately useful when they enter the English-speaking healthcare workplace and gives them the confidence that they can speak to any patient on any topic. For more videos and speaking test strategies to help you prepare, follow our social media channels on Facebook, YouTube and Instagram @OfficialOET and search the OET blog available on our website.